Dr. Sharvari Mundhe, a gynecologist, and I specialize in reproductive medicine. I'm associated with Motherhood Hospital, Sarjapur branch, Bangalore. So I grew up watching my dad, who is also a doctor, and the passion with which he used to work even on weekends and holidays and festivals. It used to give him a lot of joy and happiness, which was and is really inspiring till now. And why I chose reproductive medicine is because I saw a profound emotional and life-changing effect of infertility on the couples and individuals. So I thought I wanted to be a part of a solution that would help them achieve pregnancy. The most rewarding thing about being a doctor is basically the gratitude and the happiness that we see on the patient's face when they successfully achieve pregnancy after being through the roller coaster treatment of infertility, which is definitely very tedious one. So basically I try to follow a certain routine every day. So although people say it is quite monotonous, but I try to stick to my yoga and the daily balanced diet. And I do try to spend at least 1 hour with my son, which is like a charging station for me. And I do take night walks. So some kind of peace is required in your personal life, which charges you to work better in the professional life. So yes, I do have a lot of hobbies that includes painting. I do sing, and in my free time I write little poems, and I like to read spiritual books. So this is something which I do when I get a little bit of time. So I try to divide it. Recently started with mandala art, so which tries to help me focus in my OT procedures. So something I would like to tell who is trying to pursue healthcare as a career is to be passionate, be it medicine or surgery. It requires a lot of passion to be into the field, and it should be accepted that it is going to be a lifelong journey of learning, and you will be a good doctor only if you are compassionate and empathetic towards patient. You can be an intelligent doctor, but you will be a good doctor only if you are compassionate. So basically I have worked in the government sector as well as the private sector, and one thing I can tell you very honestly is that digitalization has helped us a lot. Like we see the evolution in the form of telemedicine or ordering lab tests or ordering any pharma medicines. The accessibility has increased, and technology definitely has evolved when it comes to video consultations or time lapse in case of our embryology field. So definitely it is going to be a game changer in coming future. So yes, I do remember one of my patients who had been diagnosed with premature menopause at a very young age of 29. And the challenging part was that the husband was also diagnosed with a very low sperm count. So first we had to give her medication to induce her periods naturally. And then we went ahead with an IVF with a donor egg and the husband's sperm, which were retrieved surgically from his testis. And then we got only one moderate quality embryo, which with great hope we had implanted inside her, transferred inside her uterus, and she did get pregnant in the very first attempt. And that was something like really a miracle, because even though we had hope, but we know that the possibility was very less of her conceiving in this all procedure. So something my motto is like work is worship, and never give up on hope, because we do see miracles happen every now and then. So just when we think that there is no hope in this case, the miracle will happen. So yes, never lose hope.